Hello and welcome back to GP Video Podcast by Nadia. Today we will be talking about fatty liver disease. Fatty liver disease, I think it's one of those terms or one of those conditions that we have been hearing about a lot in our community at this stage. What is fatty liver disease? I've done a video podcast on it before as well, but I would like to start all over again. So fatty liver disease describes a range of conditions caused by an accumulation of fat in the liver. So liver produces fat itself as well, but this is an excess accumulation of fat in the liver. This disease affects about 10% of the Australians and is the most common reason for mildly abnormal liver function test results. It rarely causes pain, does not cause nausea or fatty food intolerance, but can sometimes indicate other health problems. So what happens is, it is usually, as I've said before as well, it is usually an incidental finding when someone comes for a blood test for any other reason or for just general health checkup. Mildly abnormal liver function tests usually indicate that this is fatty liver disease, and that's how it is diagnosed. So what causes fatty liver? Fatty liver is not caused by simply eating fatty foods. It's just the name of the condition because it is characterized by excess accumulation of fat in the liver, but it does not mean that you are simply eating more fatty food and that's causing fatty liver. It is associated with health problems such as, so what happens is fatty liver disease has got four most important causes. Number one is obesity. About 20% of people considered obese have fatty liver disease. Anybody who has the BMI, body mass index, of being an obese person, not morbidly obese would definitely have some sort of fatty liver disease, but even obese people, generally obese people, let's say an BMI of more than 30, 20% of them will have fatty liver disease. Number two is high blood cholesterol and triglycerides. So high blood cholesterol, which of course is acquired by eating more fatty foods and also could run in genes and be familial hypercholesterolemia or hypercholesterolemia that runs in the families because of the genes, because of the genetic issue, because of the problem that runs in the family. So high blood cholesterol, obesity, then type 2 diabetes mellitus. Type 2 diabetes mellitus or insulin resistance is the third cause of fatty liver, and number 4 is heavy alcohol use. So fatty liver disease again can be divided into alcoholic fatty liver disease, which is caused by alcohol, and non-alcoholic fatty liver disease, which is caused by obesity or high blood cholesterol and triglycerides and or type 2 diabetes mellitus or insulin resistance. So all these four factors can be there, or one of these could be there, two of these, because usually what happens is I call these diseases as siblings. So obesity with high blood pressure, with type 2 diabetes mellitus, with high cholesterol. Usually they are all together. Sometimes people can have any one or two of these, but usually they all come in a package. Obesity, insulin resistance or type 2 diabetes mellitus, high cholesterol, high blood pressure. These four usually come in a package, unfortunately. And then if you add alcohol into it as well, then that's like icing on the cake. So these are the causes of fatty liver disease. Less common causes are underactive thyroid or hypothyroidism, certain medications, polycystic ovarian syndrome, and complications of pregnancy. And there are some other, fatty liver can itself run in the families as well, genetic or familial consideration or connection. Good news is fatty liver disease is a completely reversible disease. It is a completely reversible medication if we treat the causes. So if we treat type 2 diabetes mellitus nicely or manage type 2 diabetes mellitus nicely, if we manage cholesterol nicely, if we manage blood pressure, because blood pressure could also be one of the factors that could relate to fatty liver disease, and if we treat obesity nicely, then all of these conditions, if they are treated nicely, they are controlled nicely, then fatty liver disease can be completely reversible. So then we have got, as I've already spoken about, non-alcoholic fatty liver disease and alcoholic fatty liver disease. If left untreated, if these conditions are not addressed, and if these like obesity is not treated, type 2 diabetes mellitus is not treated, cholesterol is not treated, alcohol is not abandoned, then what happens is this benign condition or this harmless condition will then develop into harming liver more and more, causing fibrosis, cirrhosis, and in some cases liver cancer as well. So after fatty liver, non-alcoholic fatty liver disease, then comes the stage called non-alcoholic steatohepatitis. It's a chronic condition in which accumulated fat in liver cells causes liver inflammation. The condition very slowly gets worse and is more likely to be a problem if you also have another liver disease such as hepatitis B or C, or if you drink too much alcohol. In some individuals, NASH may gradually progress to scarring of the liver and to more serious chronic liver disease such as cirrhosis. So we have to address all the risk factors or all the causative factors of fatty liver that are in us. So if we are overweight, of course, a diet is very low glucose diet. Being on a weight management program is very, very important. And of course, medications, because I'm a very pro medication person. So if you can use the weight loss, if you're not able to, only with the diet and exercise, you're not able to lose your weight, of course, you have to keep on doing the exercise, which is at least 5 days a week, and the diet, which is low sugar and low fat diet. Then you can also resort to doing the weight loss medications, injections that I've already spoken about. Then, like for example, we have spoken about Mounjaro, Wegovy, Ozempic, Saxenda, all these weight loss injections which are very, very harmless and with least side effects profile and give you the best results, and you can be on them for lifelong as well if somebody wishes to. Then eat a healthy diet, as I said, especially one that is low in fat, high in fiber, low in calories. Also pay attention to food portion serves, small regular meals. Contrary to popular opinion, no particular diet is liver cleansing, but a healthy one greatly aids general well-being and fitness. Dietitian can provide you with a well-balanced and nutritious plan. Also, if you are type 2 diabetic or insulin resistant, then type 2 diabetes medications and high cholesterol, so high cholesterol medications, blood pressure medications, lifestyle interventions, all of these would help you reverse your fatty liver for sure.